So I'm George Koob. I'm the director of the National Institute on Alcohol Abuse and Alcoholism. We are one of the 27 National Institutes of Health institutes, along with the National Institute on Drug Abuse, the National Institute on Mental Health, the National Institute on National Cancer Institute, et cetera. What I want to talk about today is alcohol, obviously. You know, most countries globally have become largely used to the endemic premature deaths related to alcohol. The casualties, devastation, and associated blood and tears are all willingly absorbed into our social fabric. That's a quote from two researchers who work on recovery named John Kelly and Sarah Walkman. But it illustrates some of the points that are on this slide, which is that alcohol contributes to 200 different diseases and conditions. Most of you are probably familiar with the fact that alcohol causes liver disease. I'm sure you've heard of liver cirrhosis caused by alcohol. In fact, alcohol now in the United States is responsible for half of liver disease deaths. But alcohol also contributes to mental health problems, neurological disorders, pancreatitis, metabolic diseases such as diabetes, contributes to injuries, falls, overdose deaths. It's estimated that something like 20% of opioid overdose deaths involve alcohol. When you start combining alcohol with other drugs like opioids or sedative hypnotics, 2 + 2 = 5 when it comes to death and the possibility of severe respiratory depression. And on the left-hand side of this slide, I illustrate that there are almost 30 million individuals in the United States with an alcohol use disorder. And when you get to emergency department visits, it gets to be in the millions of visits per year in the United States, 5 million. I always argue that if you go into any major medical center emergency room on a Friday or Saturday night, half the people there are because of alcohol. So what are we doing about it at the National Institute on Alcohol Abuse and Alcohol Addiction? And one of the things we've been focusing on in the last 2 years is changing the conversation around alcohol. So one of our goals is what I just showed on this slide, which is to discuss the scope of the problem. But the other is embracing a change in the culture surrounding drinking. So maybe you're unaware of it, but there are now things like dry January or dry October where people reassess their relationship with alcohol. There are now dry bars that are cropping up in major cities, mocktails, low alcohol containing amounts of beverages. And some of these things are at least allowing people a choice, that they don't have to drink and there should be no stigma associated with not drinking. In addition, we've been pushing very hard the medical community to adopt what we call SBIRT, which means screening, brief intervention, and referral to treatment. If your primary care doctor or health provider actually asks you when you go in for a physical how much you drink, well, you're probably going to lie. But on the way home, you're going to start thinking about how much did I drink? And I would say now the data we get, about 60–70% of primary care doctors actually do ask you how much you drink. But where it falls down is they don't do an intervention and they don't refer you to treatment. And it's less than 10% in most cases. So we're really trying to up our game in that domain. We are working on enhancing studies of recovery, redefining recovery. I'll probably talk about that a little bit tomorrow. And we're trying to integrate alcohol use disorder treatment with some of these medical conditions that I've listed here, with liver docs to treat liver disease, to help people recover from liver disease, to help people recover from a liver transplant, mental health co-occurring conditions, co-occurring drug misuse, from opioids to stimulants to marijuana. Pain, another area of comorbidity that we're focusing on. We're also trying to address stigma. You notice that I used the word alcohol use disorder. I didn't say alcoholic or alcohol abuse. Nora Volkoff and myself and Josh Gordon have tried to address this problem with a major scientific publication on using words that are not pejorative. In other words, words that don't have a negative connotation. Even to the point that you heard me say alcohol-containing beverage rather than alcoholic beverage. And then finally, we have quite a few resources. I'm trying to get the slide to move forward. Yeah, that are available to you that address some of the issues I've been talking about. Rethinking Drinking's on our website. It's a print and website publication for the general audience to help individuals assess their drinking habits and find ways to make a change. College AIM is a comprehensive information on prevention approaches found to be effective in college environments. We've sent this to every university and college in the country. You can actually, every administrator should have this. There are individual prevention programs, but also community prevention programs that have been evaluated. The Alcohol Treatment Navigator helps individuals understand treatment options, including medications, behavioral therapy, mutual support groups, and search for nearby treatment and telehealth services. It also includes a portal to assist healthcare providers in making referrals to their patients. You can actually type in your zip code to this website, and it will find a treatment facility in your zip code area. You use the Substance Abuse Mental Health Services Administration portal or the Psychology Today portal. Both are linked up to this website. And then finally, we're very proud of the Healthcare Professional Core resource. This is an online educational resource, covers the basics of what every healthcare professional needs to know about alcohol, including the many ways that alcohol can impact a patient's health and provide strategy for alcohol screening and interventions. And I might add that while this is aimed at primary care doctors, it should be good for pharmacists, nurse practitioners, physician's assistants, clinical psychologists, all the way to board-certified addiction medicine specialists, but every one of you as well. So thank you very much.